ang basurahan ng market. Out there with Annie. See, may basura. Okay, ganyan lang. Ganyan na lang. Or not. We can sit like that too. But it said, naka-zoom in. Okay. Starve again. Ay. I'm eating like a hot cake. I'm like a pancake. How's everyone? Hi, first viewer Randeli again. I not. The Divine. Hi, Divine. Hi, Shiba. Thank you for the like. I'm here. I'm outdoor. Obviously, there is like a trash at my back. It's fine. We still can eat with trashes. I woke up. I slept around 2 p.m. Hello, George Lamb. Hi from Brazil. We cannot make a live streaming massage video, guys. That is because our friend Lizelle cannot go outside. She needs to stay at home on Sunday. So I called her and she refused. And so we don't have a massage session for now. We cannot make a live massage streaming. So instead, we can only talk to one another. Hi 12 viewers. Hi 19 viewers. Joaquin, thank you. Like the surrounding is so light. Hello, Abdullah Kamulu. I I was I was into Jollibee and wanted to buy some food to eat, but the line was so, like, how can you say it? There are so many in line, so I choose to go back home and buy just this Filipino snack. Di mapigilan ang lungkot na nadarama. Dito ka lang sa puso ko, kung ito'y pag-ibig na ako ta'y di nadama. Dito ka lang palagi. I try to sing sa akin tabi. I have clients at 8 p.m. you guys. I have a client at 8 p.m. I'm still so sleepy. Guys, my mind is still so sleepy. Guys, is it okay if I can sleep again? Hello, Malik. Your voice English. Is it okay if I sleep? I will still be on my live streaming. I will not leave you guys because I love you so much. Hello, Farshan. What is that, Edwin? Why us? I don't get it. Hi, Edwin. I need to lay on bed. Guys, I'm sorry. Need to lay in bed. Oh, I'm so sorry. Get our chair. Ah. Hi. Guys. It's heavy. Chair is so heavy. Dito ka lang sa puso ko. The right action is going to bed. I'm sorry, guys. Again, Annie is going to bed. If you love me, you will let me go to bed. Guys, don't be so unfair. Let me in peace. Let me in peace. I'm so tired again. I'm not so tired, but what I mean, I'm so sleepy. Dito ka lang sa puso ko, kung ito'y pag-ibig na takot ay di nadama. Dito ka lang palagi. ang lungkot na nadarama. Sa puso ko. Ito'y pag-ibig na ako tayo di naman lagi. Hi 12 viewers. Ito'y pag-ibig na. Okay. Tommy is very busy, but he was here in my other live stream. And my other time, it was like other time. Yesterday, Tommy was in my live streaming, I think. Yeah, Edwin, Tommy is my live streaming. I'm chatting a Filipina in Hong Kong. She called this morning for a second. She basically was giving her cell phone number. Oh, good to hear that, Sir Edwin. Great to hear. Guys, I'm going to sleep, okay? I'm sorry. I just need to sleep. Aray. Ah, I'm so sleepy again. Dito ka lang sa puso ko. Edwin, can you please remove that other guy there who is commenting bad thing? Thank you. Thank you. Thank you, Edwin. Guys, I need massage. Oh my god. My back hurts. I need massage again. Hi, Ben. Oops. Edwin, it's not night here. It's still afternoon. It's 4 p.m. I can sleep, okay? I can sleep. Take a nap. Let me know if if I'm drooling or I am snoring. Thank you, Edwin. When I wake up, look, what the heck? What just happened? Ah, electricity interruption. Taga saan ka? Jan Yamalo. Hi. Jensen po is a lazy vlogger, lazy YouTuber, lazy host. Jensen po, Jensen. With dreams. same position. This is how I really sleep. Like I sleep like the same as having massage. I don't wake up because I want to sleep. I will want to lay on bed. No, I just lay on bed, Sir Edwin, but I just need to wake up later because I have my clients. Ouch. Hello, Samson. Hello, my crush. Arnel Samson? Sounds familiar. Kakayanin, kaya ika'y wala. Ay. I found out that I just need to lay on bed, but not really. Or shall we read the book that we can discuss for tomorrow for the students? Wait. Kakayanin, kaya ika'y mawala. Sa kanya ipaubaya. Kakayanin, kaya ika'y mawala. At sa kanya ipaubaya. Okay, this is what I'm going to read tomorrow for the students. So since we're going to start with our clinical practice, so our first topic is all about vital signs. So what do you mean by vital signs? So yeah, vital signs is a way of checking your patients and to evaluate their temperature, their pulse, their respiratory rate, their blood pressure, and pain. So how will you get their vital signs? So you have to check, you have to place, like for example, you have to place your temperature. I'm in a thermometer in four, wait, in four routes. Either you can place it into tympanic, rectal, oral, or axillary. Or you could also take placing of blood pressure, pulse, temporal, temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior, tibial pulse, dorsalis. So we have a Korotkoff sounds for the blood pressure. So sound systolic, then diastolic. Systolic is the high, diastolic is the low. I'm studying now, guys. Tapping sounds, tapping, swishing. In case as the cuff is deflating, tapping sounds systolic, taas na pressure. Sounds that in case as the cuff is deflating, will as fast of the sound. Knocking sounds occurs with each heartbeat. Tick, tick, tick. Muffing sounds indicates systolics in children. Silent systolic pressure. Systolic pressure, silence. Tapping, swishing, knocking, muffling, and silence. So, sound systolic pressure, taas na BP. And then, pag-inflate, medyo na ay mga tak, 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 or heartbeat. Each heartbeat. Systolic pressure is consistently between 85 to 150. 80 to 110. Which book is it? This is my reviewer. This is a midwifery book. Pulse. Kasi mang i-check sa pulse. Right niya, rate. Rhythm. Rate. Pulsation per minute. Ilang pulse per minute. Rhythm between each pulse. Rhythm. Tuk, 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 tuk. Rhythm. Intensity, force, or volume. Is it strong? Is it weak? Conditions of artery, normal, soft, and elastic. Soft siya, hindi siya gahi. Elastic. So, rate, ilang pulse. Rhythm, between each pulse. Intensity, force. Below the jaw, cardiac arrest. May cardiac arrest, carotid pulse. Apex of the heart. Hindi siya not palpable siya. Just below the nipple line in an aid of stethoscope. Not palpable. Hindi siya mapulp. Okay. Hindi siya mapulp, aid of stethoscope only. I'm sorry guys, I'm studying here. You would love to hear more about my book. Okay, you want to know about my book. Okay, so I have, okay, we can make some lecture for you if you want. Okay, so this is the book I bought before I passed the board examination for midwifery. This is the book that I read for 8 times, I guess. So this is the book I read. So this is You Can Tap and Pass the Board Examination, Comadronas. So this book comes with a lot of different topics. So there we have an obstetric, and gynecology, fundamentals and health, infant care and feeding, primary health care, and also the PGD or professional growth. So PGD is about law. So that's the five core subject of a midwifery, and that's what we need to pass during the board examination. So we have 5 subjects. So tomorrow we have this class for the student for only 3 or 2 hours, and I am still looking for what is the best topic for them to know, since we handled the clinical practice, and mainly we need to focus about the clinical practice for them, but we also could really share them some of the major part of that profession. So, yep, I have here like four basic method or techniques that use per physical assessment for the patients. Have you had in the hospital, you guys, I know you've been in the hospital and you always see that when you go to the emergency room, we, like the doctor has an assessment. So they have like four assessments. So we have here the inspection, palpation, percussion, and the auscultation. So if you wanted to know, then I'm not going to. Why I'm lecturing here? No. So inspection, it is the body movement. Like, hey, can I check your hands? Like, can I hold it? Oh, now it's flexible. There is no any other fracture or so. Can you be able to move your finger like this? So that is the inspection. So it's based off what you see in the patients, and that is what doctors do. And for the palpation, it is using the sense of touch. So you have to palpate, just only like that. You have to palpate. Is there any there? Is there a mass? Is there a dislocation of the bones? So that's a palpation. And for the percussion, it is a way of tapping. So you will have to place your finger, your palm, and then you have to do that tapping. If you heard something not right, then that's something that might be there's something like abnormalities. So that's a percussion. And then the auscultation is you have to use with stethoscopes, and that's what you always hear when the doctor is going to check your lungs, your heart sounds, or your bowel movement sounds into your tummy. How many types of normal delivery? How many types of normal delivery? You mean like the rate? I don't know the rate right now based in the DOH. I'm not updated for it. So what's in the book again? Actually, it has an order. So we have also here like the vital signs, temperature, pulse rate, respiratory, blood pressure, and pain. Then methods of heat loss. So this is the most important as well, because during the board examination, it is being asked like method of heat loss. We have here radiation, conduction, or convection and evaporation. You have to say like if like the plate, like for example, like the newborn is under radiant warmer and then radiation's heat lost. It means like when you place a cold items besides the incubator. So you see in my videos where I work at the hospital and then the baby is inside the incubator. So let's say you put something in the incubator and then it will going to prevent the place from getting warm, and that is what the radiation is. It's basically not directly contact with your patients, like it's not being touched. Like you only have to place, let's say like there's like a cold object that is being placed in one place, and then it will going to get all the warm temperature, and that's what the radiation is. And then when you say like conduction, it is also direct contact, like you put your baby in the crib without any blanket, and so it will going to make the baby feeling so cold, and that makes her hypothermia, and you should have to wrap it and just put the baby with a lot of like comfy blanket, and also like you have to put like a bonnet for the baby, and that's what in this topic. Yeah, I just read this like more many times. Convection, heat loss from body temperature, like air conditioned, electric fan. Evaporation is from liquid or a vapor. So we also have here a common site of temperature taking. We have like, you do you see that, guys? During the COVID pandemic, we usually have this tympanic temperature. They have to check it, or like the other one where they check in your head, the forehead. So yeah, we have like a tympanic, rectal. Have you tried? I never tried that. Rectal, oral one, and then the axillary. Route 4, taking a temperature. Then we also have here like pulse assessment. This is the most pretty much interesting with this book. Like, hey, we have here a pulse assessment. I thought before like, hey, I only have like radial, brachial, carotid, temporal, pulse, but then I still have a lot of pulse to check in. So we have here like temporal. This is what I've memorized before, you guys, before I pass the board exam. I just always say like this is like this is like that, this is like this. So we have here temporal, we have here carotid, apical, brachial, radial, um, popliteal, I know, femoral. So I know femoral is here, femoral, popliteal, posterior tibial pulse, and dorsalis. So for temporal, not accessible. Ah, okay. Below the jaw is the carotid, not palpable. But this is for infant, maximal im, maximal impulse digoxin. Okay. So yeah, it's just pretty much interesting. Okay, we also have here much more interesting stuff here is okay, like infections. Some diets, we have that here. What the heck is that baby? So I guess I know what I can discuss for tomorrow. Calf. I need to take a picture with this one. What the heck is that baby? The kiddo. What in the world? How long did it take you to learn everything? How long did it take me to learn everything? Well, I guess I've been started to study for 3 months consecutive, straight for 3 months straight. I always been reading this book for 3 months, and yeah, that's how I master all this. So and then sometimes I just forget some of them. When you were in a clinical practice, you just basically more into doing the thing, doing the job, but you don't always have to, you just have to refresh like, hey, I read this before, and then you just open your book and then you do some research. Now I get it. Like, yeah, it's just it's just what the patient has, like it's signs and some other, something like that. But yeah, and it took me like 3 months to learn. It took me 3 months to always review. We also have here abnormal obstetric, direct maternal death and direct maternal death or coincidental. And then the postpartum hemorrhage, how much per ml is the lost, the blood lost, or how much is the normal blood lost. What else? We have postpartum blues, postpartum depression, how to diagnose it, postpartum psychosis, degrees of labor, perineal laceration. Oh wait, this is the most interesting stuff that I like the most. Where is it? Where is it? You have here a pharmacology. Like everything seems in here. Where is it? No. I bought this book for like 2,700 pesos with shipping. This book is from Manila, and this is being wrote by one of the registered nurse, one registered midwife. So they made this book themselves and then they sell it in the Philippines. And yep, that's what our reviewer is. Everything is indicated. It's very concise. Like, hey, we also, like, during the delivery, during the, like, when there is like a pregnant woman who enter in the emergency room, they took this x-ray and then they bring it in the delivery room, and then that's the time we also see the picture of the x-ray and we can diagnose it by it if it is like that. So yep, it's like the pelvis. This is a pelvis of the guy and then the woman. So we can diagnose it by that. So we also study that though. The measurement, the station from the baby, which part is it below the ischial spine, it is above the ischial spine, the measurement. What else? Fetal head diameters. We also have that. Maternal nutrition. Yeah, we also have here maternal nutritions, maneuver. So how will you check the baby's position? Computations of the pregnancy, prenatal checkup for antenatal. Here we have respiratory problem. What else in this book? We also have here the integrated management of childhood illness. So we have here the diarrhea, air infection, acute respiratory infection, dengue fever, malaria, measles, malnutrition, and fever. Alright, so we also have here, this is the latest, the coronavirus is also being asked during the birth examination. It was during my time, but I think like only 2 questions was appeared, or like 1 question only. So we have here a coronavirus disease. So we have that here. Intermediate host during this time is unknown. Incubation period, how it will going to spread, the signs and symptoms, the risk individuals, the diagnostic test, national response to COVID-19 pandemic, WHO response, vaccines and treatment. We also have that there. Ebola virus, we have cephalic tetanus, tetanus lacto, how will you diagnose tetanus, bacterial infections, diarrhea, mumps, epidemic for parotitis. I forgot some of them. Vaccine preventions disease, measles and rubella, leprosy, Hansen's disease. What else? We also have here a pulmonary tuberculosis diagnosis, and yeah, it's a lot. Like it is more. Like there is like sputum examinations, sputum, x-ray, tuberculin test, Mantox test. I know that. I know that when I work an actual job, if I heard something, okay, Cox disease is just also like a tuberculosis. And so either we can check it via x-ray, or we can make a confirmatory test via sputum exam, or we can have like a tuberculin skin test or Mantox test. Hi Randy! I'm showing them what my favorite book. No, this is my reviewer. So we have here rabies as well. So yeah, this is where I found out that the rabies, like if you're kissing your dog, you know, like there are so many vloggers and more people who has a dog and they get used to kiss their dogs. You know, it's just risky. It's just risky. The saliva of the dog that they kiss, if you don't have like an open wound, it's just fine. But if you have an open wound and with direct contact to your wound, to your bloodstream, it will going to you will going to get the virus. So that's just something so risky. Like, hey, don't ever kiss your dog. Like, hey, no, I'm kissing like my dog. No. You don't have to kiss your dog. It's just really like, because it's being right down here. it's not just about the dog bite, but the saliva itself has its rabies, and so you have to be careful when you have a dog. Well, just for example, you have like this plate, and then the dog is just like eating with the plate, and then there's like some saliva with some rabies in it, and then you wash it, but then the rabies is still there, then it's being contaminated to the food you intake, then that's the time that you can get the rabies. Yeah, yeah, the baby, yeah, of course. No, they didn't know it, they didn't know it. Okay, so right now, during July and November in the Philippines, we have a high rate of dengue fever because it's rainy days. And then I have here like a dengue fever. How will you diagnose it? So we have also so many patients. You will expect like if the patient has this fever, on and off fever for 3 days, that means like the patient might have a chance that she or he has a fever, has a dengue, most especially when he or she lives in the country with like a rainy season. So we have here like a dengue fever, also known, yeah, DRTNS1, IgG, IgM. So some of the drugs we gave. So management for dengue, do not give any aspirin, guys. Always remember, no aspirin, anticoagulant drug. Okay? Do not give an aspirin for the patients with diagnosed with dengue fever. No aspirin. You have to put that in your mind. Filariasis, elephantiasis, malaria. No, there's no so much case with malaria in the Philippines. Like, no much, there's no so much cases of malaria. Like, it's totally almost like gone. Really? Together with HIV, AIDS, tuberculosis, and other neglected tropical diseases, malaria control includes under Sustainable Development Goal. Female Anopheles mosquitoes, leptospirosis. Oh no, no, the leptospirosis and then the dengue fever. When it's raining so much, there is a high chance that more people could get a dengue fever. And at the same time, if there is a flood because of the rain, then it might going to be one of the causes for the leptospirosis. We had a patient, and we seems like we think about it was like 3 months ago. I was assigned at the third floor, and we have this case, and the doctor said like that patient has leptospirosis. The diagnosis was leptospirosis. His eye is turns into yellow, and then with like a massive tummy, really tender, immovable, no bowel sound, and has a fever. And it was being late that they bring the patients to the hospital, and he's still young. No, I mean like he's still young. He's a guy, okay? He's still young. I guess like he was 25 years old. Dito ka lang sa puso ko. Okay. Hand hygiene, hand hygiene. So we also have here Lowe's, Filipino Lowe's. Oh, he was very sick. Yeah, he was very sick. Actually, he was very sick. It was being diagnosed with leptospirosis. It's not very common disease in the Philippines. Um, he was a construction worker. Actually, he was a construction worker. So he was dead. Like, he's dead. It's just too late. We have here like a malnutritions for the kids, for babies, postpartum care, postpartum visit, tetanus toxoid immunization schedule for women. What else? Maternal death. Death of a woman while pregnant or within 42 days of terminations of pregnancy. So we have here target settings before we start to you need to memorize this first. So BCG, like vaccinations, that's the vaccinations. Mm, what else? Immunization program, we have that. Herbal medicine, we have that. Department of Health. Primary healthcare workers. This reflexes of newborns. Yeah, we have this assessment during after delivery, and during I know after the delivery we have this assessment for the baby. So we assess their eyes, if it is normal or if it is not. Everything we have to check. Okay, anthropometric, expanded newborn, lots of them. Actually, this is like 200 plus, 281 pages. Apgar scoring. You know what Apgar scoring is? When the baby is out, we have to also assess the way the baby can cry, the way the baby can breathe, the color. That's what we assess. Burns, we also have here a burn injury, and then the first aid for the burn. So okay, this is for you guys. So when you have this first degree, obviously the only skin that is being burned is the epidermis. So with that, you only have to put cool running water. And then from the second degree, you have to do a cold compress if running water isn't available, or you have to, yeah, it's just like the same. For the third degree, yeah, it just needs some bandage. And the fourth degree needs as well for some bandage. That's it. Seek for hospital. Okay. Drug classification and actions. Common routes for drug administration. Pharmacology. Type of vegetarian diet. Type of vegetarian diet. We have here dairy, egg, fish, and poultry or chicken. So we have here vitamin K. Type of vitamin K. Vitamin D, mineral sources and efficiency, ascorbic acid, fat-soluble vitamins, that is A, D, E, and K. I only burn myself when cooking. We also have here two types of fat, water-soluble vitamin, types of fiber, three basic. No, I don't memorize them all, you guys. But if I can read, I can remember. Okay, we have, this is the most interesting part. HIV/AIDS is increasing so much right now, most especially in General Santos City. So we have, I assist, it's just me and my other worker who is a nurse. We had this one HIV patient that was diagnosed 5 years ago in Davao City, and that's the time that the HIV rate in Davao was increasing, and she got that HIV/AIDS, and then now she's here in Jansan, and it's her second pregnancy. That was the most cleanest delivery I've ever had in my whole entire duty. There is no any other contamination. We are very secured. We are very careful. We have goggles, we have gloves, double gloves. Actually, I wear two gloves. Obviously, I don't wear two gloves during the delivery, so I wear two gloves. I have this PPE and apron. I have this, the weighing scale is being wrapped with some plastic, no any other contamination. Oh, you're awake again from your coma. Yeah, yeah, yeah. So yep, that's one of the most risky part of working as a health worker, when you help for the birth from the patients with some other infected diseases. So yeah, so causes and agent: human immunodeficiency virus, origin link in chimpanzee in Central Africa. Risk factor is anal sex by men, sex men, and anal sex by men, sex men relationship, vaginal sex, oral. Oral sex? I don't know this. Really? Oh no, yeah. What in the world? Like, hey. Okay, so meaning to say, if you have like a cut, yeah, if you have like a cut into your mouth, or you have a canker or sewer, and then you did a blowjob to your, no, I mean like you did like some oral sex, that means you might get infected when there is a bloodstream contamination. So if your saliva is just has like this seminal fluid, during the oral sex, and then the seminal fluid along with the saliva was going down to your tummy, and you have this ulcer, and it will just enter into the ulcer, you know, the ulcer, and it will go into contaminate in the bloodstream, and you will get infected with HIV. No, it's not just the saliva. I mean, this is the thing. It's not just the saliva, okay? What I mean is that when you do oral sex, and then there is a seminal fluid contaminated, and it is just being mixed in the saliva, and you have like an ulcer, or you have like some cuts here, or wherever in your part of the of your mouth, and it's been contaminated with some blood, then it will going to enter in the bloodstream. So the first thing that would really get into is the bloodstream. I'm not saying about the saliva, okay? Needle or sharing needles among drug user. Mother to baby during pregnancy is vertical transmission. So when the mother has an HIV, then the baby has its HIV as well. Diagnosis is ELISA screen test for HIV. I had tested twice. Last year on months of May, I have test from it, and I've also had a test last November. So yep, I have that. Western blot confirmatory definitive test to HIV. Western blots. No, we only have like this ELISA test. So this is the test I've had, and that is the screening test for HIV. So positive HIV means positive is reactive and negative is non-reactive. Viral load category for HIV. Ooh. Okay, viral load. We have category 3. So for the first first category is asymptomatic. So the patient is asymptomatic. There is no any other symptoms. The patient is just obviously fine. Basically, there's no any other signs and symptoms for HIV. They're doing fine. So that's the first stage. That is the category 1, which is the acute stage. For the second stage is the chronic stage. That would be asymptomatic HIV stage. So asymptomatics, meaning the HI that there is like a symptoms to the person who got infected, and it has the CD4 cell count. So they count, okay, they count. Either it is 500 to 800 mm3. I don't know that. Okay, so for the third one, that would be the AIDS, the AIDS. After the HIV, if you're not going to take any other medication just to lower down the virus cells to make it sleep, then that turns into category number 3, which is the AIDS, or with opportunistic infection, opportunistic infection. So the management is antiretroviral drugs, vaccines, there's no any vaccine, but wait for that, guys. I will gonna make a vaccine for HIV chart. Guys, we help one another. Like, I guess, you know what, I think there's, because there's no vaccine for the HIV, meaning to say you have to just only be more healthy, do some exercise, eat healthy, plenty foods that has much more nutrition. So yes, prevention, abstinence, be maturely faithful, consider correct condom, okay, drug, do not use drug, do not self-inject, and do not share needles. Early detections and education. Okay. Genital warts. Hello, I am your big fan. Hi. We have also here hepatitis, sharing needles, droplets, and food. Hepatitis B is by droplets and food. Like, hey, before you kiss someone, please make sure that the guy or the woman has no hepatitis B, because the hepatitis B, you can get that from saliva. So when you're kissing someone, like, meaning to say you will get infected. So yeah, be careful when kissing someone. We have here candidiasis, moniliasis. Yes, fungal infection. So this is not a UTI or an STI, but this is a yes infection. Test. Itchy. Cute, cottage cheesy, white curd-like vaginal discharge. Fluconazole. Okay, for the candidiasis moniliasis, the treatment is the fluconazole. What? Okay. For okay, for the candidiasis moniliasis, you know what? This candidiasis moniliasis is like from when, wait, drug like corticosteroid and so it doesn't mean that if you have like a woman, or if you have like a person who you know with diagnosed with candidiasis moniliasis, it is a thrush. So it is a thrush, so it doesn't mean that the patient has AIDS. Ah, the patients might have like use an antibiotics, diagnosed with diabetic mellitus or HIV. Doing too much cleaning to your vagina. So, use an antifungal cream in vagina or single dose of fluconazole, or thrush, or treat a nystatin ointment. And also eat food rich with probiotics like yogurt. So, if you know somebody, guys, who has like candidiasis or moniliasis, it is like the itchy or like some other discharges for the women, like a cheesy discharge, then that might be they just have to take like a fluconazole, or also put a diet into the food they eat with a probiotic food like yogurt or some yogurt. Eat probiotic food, yogurt, cheese, and avoid frequent dowing. Dow, the bacterial vaginosis, fish odor, metronidazole, syphilis, sexual contact, canker sore, ulcer, hallmarks. Syphilis. Most infectious bacterial present in sores or painless around the genitals area in anus or in the rectum. Okay, guys, wait. So we have here a syphilis or bad blood, or a great pox. Causative agents is Treponema pallidum. Incubation period is 10 to 90 days. Mode of transmission is sexual contact. Also put no, don't put yogurt in the infected part. So sexual contact, then signs and symptoms depends of the stages of syphilis. So the signs and symptoms of syphilis is usually depends on the stages of syphilis. Hallmark is canker, painful, sore, or ulcer. Stages of syphilis, we have primary, secondary, and tertiary. Okay, so new information for you guys. So the primary stage would be 3 to 6 weeks after the contact or after you get infected. So this is the most infectious and the bacteria presents in a sore. So yeah, be aware for that. Cancers or penis are about the genital area and around the anus or in the rectum or in around the mouth. Secondary is symptom systemic infection. There is like a rush including palms and soles, including palms. Yeah. Guys, I will get back. Wait, I will get back to you, okay? Alright, I'm back. I'm back with another vlog. Is how they treated thrush in the older days before lots of medication came out. Yeah, maybe there is a new medication came out. So, for the where are we? So where are we? We were in the syphilis, okay? So the first stage would be 3 to 6 weeks after contact, and this is the most infectious. And you have this canker sore or I mean sore into your genital areas. Then the second one is systemic infection. Either you can have like a sore throat, you have a patchy hair loss, headache, weight loss, muscle aches, fatigue, fever, or rash including the palms and plantar lesions. Then the tertiary stage would be 60 to 40 years. Non-infectious. So if you're treated with syphilis, you can still live for 40 to 40 years old. So you will not, you